and one that I'm sure none of us will forget. And then if you're young enough, you'll be telling your children and your grandchildren about the great pandemic of 2020. But I know I speak for everyone in the task force health systems when I say I hope that you will experience really incredible joy and peace this holiday season despite all of our year's challenges. The good news is that we now have 2 authorized vaccines that will, over time, prevent spread of the deadly virus and save lives. And this is truly wonderful news, but we still have a long way to go to get through this pandemic. And the sad truth is some people won't be able to celebrate Christmas at all this year because they've become infected with the virus. And we still have a high number of patients within our hospitals, and we're still admitting close to 100 patients a day on average. So please continue to do all of those things that we've talked about over these months. Stay at home this Christmas. The vaccines will help, but they aren't going to help us before Christmas, and they won't protect you if you attend large family gatherings. So, as I've said before, this is a war, and COVID won't observe a Christmas truce. So if we let our guard down now, the virus will take advantage of that, and we'll start to see a lot of people get sick again. And we certainly want everybody to enjoy the holiday, but do it safely so that everybody can enjoy holidays for years to come. Again, we will win this war, but we won't win it this week, not for months. Right now, the numbers have been softening, but are still too high. So we don't want to slide backwards. We don't want a post-Christmas surge that would put too much stress on our healthcare systems and our healthcare workers. So please give these exhausted healthcare workers and those that support them the greatest gift that you could give them this year, which is to stay home and prevent the spread. Now, there's also been a lot of news about a new mutation of the coronavirus coming out of the United Kingdom. So keep in mind that viruses mutate all the time. While all of us are interested in learning more about this strain, the best thing that we can do to keep the virus from mutating is to keep it from spreading. That's how mutations happen, is when it spreads. This new strain is one more reason to keep our guard up as well, keep our masks on, and keep our distance from others. So let's take a look at where we are today, and then we'll talk a little bit about modeling slides, and then we'll conclude. So we'll start, as we always do, with our new hospital admissions, and again, these are COVID-positive patients admitted to the hospital, a 2-day lag. So today, we're reporting 87 new COVID admissions, which is coming down. Our rolling 7-day average is now at 109. Now remember, this average has continued to stay above 100 for well over a month now, and that's still a really high number. So although we're encouraged by those decreasing numbers, we can't declare victory until those numbers reach 0. On our hospitalizations, and again, these are COVID-positive patients only, today we're reporting 873 patients hospitalized with confirmed COVID-19 in our task force hospitals. Now, this is a little bit up from where we've recently been, and again, it reinforces the point that we're not out of the woods yet, not by a long shot. The moving average now is at 877, so still a very high number of patients within our task force hospitals. This next slide shows our COVID positive patients only, a little bit more in depth. As we reported, 873 patients hospitalized today with COVID-19. 185 patients are in the intensive care unit, which is a little bit elevated from our most recent census. And we have 114 confirmed COVID patients on ventilators today, and that's down slightly from yesterday when we had 117. Looking at our suspected COVID patients, you can see our numbers here. We're reporting 73 patients with suspected COVID in our hospitals today, 11 patients in the intensive care unit with suspected COVID, and 5 patients on ventilators today with suspected COVID. So again, combined with our positive COVID patients, still above 900 patients in our hospitals. On our good news slide for today, yesterday we discharged 85 patients from our healthcare systems. So again, a great credit to all of our healthcare workers and everybody that supports them to get these patients well enough to go home for the holiday season. To date, we've discharged right around 13,000, almost 500 patients from our task force. Happen. So today we're reporting 15 more COVID deaths from across our healthcare systems, and that's moved the 7-day moving average to 18, so come down slightly, but still any death is really one too many. And our next slide is we typically show the relationship between those new admissions, the hospitalizations and deaths, and you can see how all those curves follow each other. And so the best way to prevent the end result of a death or an intensive care unit admission is to prevent the infection in the first place. And that's where the community comes into play by following all of those mitigation strategies with wearing a mask, staying socially distant, and not gathering in crowds. Moving on to our models now. So last Thursday, we did update our model for our projections for COVID-19. And you can see on this slide here that it has changed. So before, the graphs were going in an upward direction, and now because of the census numbers plateauing and our admission numbers coming down, our models are now reflecting that. And so a slight downward turn. Now you can see it's relatively flat though. So what that means is if we continue on the current trajectory, it's going to take a while before we get those number of patients down from our hospitals. And that is if we continue on our current transmission pattern or our current reproductive factor. And so it's encouraging, but still we would love for this to come down even faster. And the way to do that is to reduce transmission in the community. A little bit more about scenarios that we can see playing out going into the future. And so these are sort of our what-if scenarios. So if we did see a surge in coronavirus patients from the holidays, if people did get together with, large family gatherings or going out into spaces where there's a lot of people, then we will see an increase in transmission, and that's what the red line there represents. Is if we saw a reproductive factor increase up to around 1.45, we would see a dramatic increase in the number of patients coming to our hospital. If we stay about where we are, that's the blue line, and if we have a dramatic downturn or improvement in the transmission rate, then we'll see the orange line. And so you can see how reducing transmission has that impact on inpatient census. So anything that we can do to decrease transmission in the community will play out in hospitalizations, ICU admissions, and of course fewer people will die from the virus. So it's really up to us to protect everybody in the community. These next couple graphs are really just larger pictures of what I was showing you before. So you can see here our hospital census has plateaued, and overlaying the new model on it shows how it is starting to make that slight downward turn. Not a huge turn. It's not like it's going to drop off a cliff or anything like that, but it's encouraging, and we'll take that over the upward growth any day. And the slide for our intensive care unit admissions. And you can see that we have come down considerably in our ICU admissions. And again, I think that's a really a nice tribute to all of our healthcare workers using all the therapies that they can to keep people out of the intensive care unit. And so really a tribute to them for keeping people as well as they can while they're in the hospital. Okay, a couple of other slides we'll run through with you. This is our Epicurve. Again, it shows the cases throughout the St. Louis metropolitan area. The cases have come down from that high of about 3 weeks ago. Again, they've somewhat plateaued over the last couple of days, over a week. But we have seen some consistent decrease in the number of cases as well, so that's good news. And then our Epicurves from our counties throughout the region. We're seeing similar stories across the board in all of our counties with the cases starting to come down. They are somewhat flattening, so hopefully these case counts will continue to come down. But again, that's all dependent upon what we do as a community. And that's really reflected across the state as well, although some are coming down at a faster rate than others. And so you can see here how a lot of the different regions across the state, the cases have come down, whereas some of the other ones, they've really flattened more than they've come down. But the St. Louis metropolitan area has been decreasing, and so that's good. Our reproductive number is sitting right at around 1. It's around a 0.97 right now. Again, we would like that number to come down even further, and that's what's really going to drop the cases down. And just to reiterate, doing all of those things that decrease the risk of transmission is what's going to bring that number down. So with all of those cases dropping, the map is mostly blue this week. And again, this measures the number of cases over the most recent 7 days compared to the previous 7. And so if this week's numbers are lower, then the color is going to be blue, and if they're higher, then it's that burnt orange brownish color. And so you can see here there's only a couple of counties, Calhoun and Lincoln County, where the numbers were higher than what they were in the immediate 7 days, than in the previous 7 days. And so really that's good news across the board. And then looking more specifically at some of the zip code level data on where those cases were increasing, you can see a couple of areas here that we're looking at. So one is Maryland Heights. The city of St. Louis had an uptick in one of the zip codes, and then on the east side it was Troy and Belleville, Illinois. But as you can see, reflected in that county data, most of the zip codes are that blue, which means their case counts were lower this immediate week. So in conclusion, we're starting to see some progress, but we still have way too many people in our hospitals that are sick, and we're still admitting way too many people to the hospitals. We're still at that 100 person per day average, and that's still very high. So we know vaccine is starting to arrive. I did confirm that with our teams today. They did get the allotment that they had asked for. And so we didn't see any decrease to our hospitals in the vaccine that they had asked for, so that's good news. But again, it takes a while to get people vaccinated. Don't forget it's a 2-shot series separated by multiple weeks. So what that means is it's going to take a while before we develop any sort of herd immunity out in the population. So until that arrives, we still have to practice all of those mitigation strategies that we've been talking about for so long. And it's especially important during this holiday season, as we all want to be with our family and our friends and celebrate. It's very important that we be mindful of not gathering in large crowds and practicing social distancing. We know that that's not normal for a holiday season, but this isn't a normal year. And so we appreciate everybody's efforts with that. We need a few more months until we can get enough people vaccinated where we can finally start to relax, but the time to relax isn't now. So as was mentioned earlier, we don't have any questions from the media, and so we are going to go ahead and sign off. Thank you for joining us today. Get through this pandemic. And the sad truth is some people won't be able to celebrate Christmas at all this year